My name is Damian Clark. And if you have both Medicare and Medicaid, I have some really
Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EGBERTOWILLIES. That is at Egberto Willies. Let us engage. It is Politics Done Right. Well, folks, welcome to one more edition of Politics Done Right. I'm Egberto Willies, your host. Thank you so kind for being a part of the show. We are going to have a great show for you today. Today, it's going to be mostly, I hope, on Medicare, and I hope folks give us a call if you have questions, etc. But we need to talk about Medicare. We need to talk about Medicare Advantage. This is so very important. This is so very important. And it is something that is upsetting because just like we have destroyed the private health insurance system, that the private insurance companies have pretty much destroyed our healthcare system. Once you became 65, there's so many people out there that are, 55 years old, 60 years old. And what I hear a lot of them saying a whole lot of times is, I can't wait till I turn 65. No longer have to deal with this crap of private insurance companies that are suckering us, that are ripping us off, that are doing all these things. I can't wait till I turn 65. I can't wait till I turn 65. I mean, there are so many things that I just say I'm going to not even try to go to a doctor, the possibility have a pre-existing condition that later on becomes problematic because we have private insurance. It's a shame. It is shameful that this is where we are. This is what we're living through. All right, welcome aboard. First one in today was Joanne from California, Los Angeles. Joanne, I never got the video, and I was hoping that I could get that video from you, even if I had to clean it up. What is the status? Are you going to be able to get it or not? Because I kind of looked around and I didn't see any of that on the internet, but I know that you said you were there, which makes it even better. Makes it even better. AVQ is in the house. What's going on, my brother? I hope things get better. Sorry that you're having a rough day. Is there anything that I can do to somehow make your day better? Send me a private message, brother. I hope you do better, brother. I hope you do better. All right, we got Harry Denson says, good afternoon, Egberto, and all the KPFT listeners in the state of Texas and around the world. Let us all engage with each other and get edified. Let's do that, brother. Let's do that. Let's say HZ Eric is in the house from Kingwood, Atascocita. Of course, Harry is from Missouri City, Texas. We also have in the house Patrick Magner. Meow. Patrick, I really want to get us talking on that AI thing next week because I think we need to talk about that for real. I don't know if you listened to my program this morning with what happened in Holland. What happened in Holland is the left won after a right-wing coup was running the country for a while. And they had a statement on AI that was pretty damn similar to something that I have been saying, but I want us to discuss it and, I don't care. Being right isn't all it, you know what I think. We just want the correct answers. We just want things to be right, not individual people right, but things to be right. All right, Jacqueline Campisi, la profesora Jacqueline Campisi is in the house. All right, absolutely. That's what we'll do, Bruce. What we'll do is we'll set up the call and all of us can be on at the same time for one of the shows next week where we have Brother Patrick and Brother Bruce Pollard. Bruce is our resident, I call him our resident PhD, you know. We get a lot of good input from Brother Bruce as well. Let's see. Always a learning opportunity. Absolutely right. We also have, Bruce Pollard is in the house from Kingwood. Jacqueline Campisi from Katy, Texas. Our professora is in today. You know, I always have my professoras on. Yvette Avery Herod, our what do I call Yvette? Yvette is our queen of getting things done. She's a union specialist, I call her a lot. Para ver quién más está aquí. On the other side of the aisle, we have Angie Decadence, Philip Kafer, Derek Relton, Steve Quick, Elwin Hudson, Dina Rodis, Maggie Neal. Thank you for being here. Hey, Bruce, you know, you use a word I don't know. Time for tensor magic. Is that something that's kind of... Is that like a strictly American thing you have to be born with to know that word? Because I don't know what tensor magic is. Who knows? Anyway. All right, folks, let's get busy. We need to talk about Medicare Advantage frequently and often. I know for some people it may be repetitious, but I get a headache when I watch commercials that's on TV. All of you all know that airtime is very expensive. When you put something on TV, it costs a lot of money. Okay, I'll look it up, Bruce. It costs a lot of money. All of these private insurance companies spend a ton of money advertising for Medicare Advantage. We all know, let's get rational here. Why in the hell would all these companies go ahead and spend that kind of money advertising to give you some sort of Medicare? Why? The only reason has to be that it is extraordinarily profitable. Let's go a little bit further. Go look for your insurance agent that's going to sign you up for either traditional Medicare plus Medigap or sign you up for Medicare Advantage. Ask them to be honest with you and ask them how much do they get paid for selling you a traditional, for signing you up for traditional Medicare as well as a Medigap plan. The Medigap plan is a private insurance that covers the 20% that traditional Medicare doesn't cover. I'm going to explain it in general in a little bit. Ask them, how much do they make? They make a lot more selling you a Medicare Advantage plan than they do selling you a traditional Medicare plan with Medicare, with a Medigap program. Why? Because it's very profitable. They make thousands of dollars per Medicare Advantage sales. That has to tell you how much money there is in Medicare Advantage. And that money doesn't go to you. I want to first show you a commercial. It's the only video that I have for today. I just clipped it. You know, as I was saying, I want to talk about Medicare Advantage on the program. I look to the left on, I have several screens going. I look to the left and there it goes. Another Medicare Advantage commercial. Do you know that they are going to be playing? Think about it. I want you to calculate this, guys. 500,000 spots for Medicare Advantage. 500,000 spots for Medicare Advantage. And this is what they all look like. They all look nice and sweet. This is what they look like. Check this out.
Hi, my name is Damian Clark. And if you have both Medicare and Medicaid, I have some really encouraging news that you'll definitely want to hear. Depending on the plans available in your area, you may be eligible to get extra benefits with the Humana Medicare Advantage Dual Eligible Special Needs Plan. These plans have a $0 monthly plan premium. Most plans include the Humana Healthy Options Allowance. Get over $1,000 a year. That's $85 a month to help pay for covered over-the-counter items like vitamins, pain relievers, first aid supplies, and more. The Healthy Options allowance is loaded onto a prepaid card each month, and whatever you don't spend carries over from each month. Call today to learn about all the items covered. You could have $0 copays on hundreds of prescriptions all year long, including select brand name drugs. All plans have $0 copays for covered preventive dental services, which include 2 free cleanings a year, as well as coverage towards fillings. They also have vision coverage, including vision exams and a yearly allowance towards eyewear, such as lenses or contacts, and hearing coverage, which includes routine hearing exams and coverage towards hearing aids. Plus, your doctor, hospital, and pharmacy may already be part of our large Humana networks. So call the number on your screen now to speak with a licensed Humana sales agent. Wouldn't you love benefits like a monthly allowance to help pay for covered over-the-counter items? So if you have Medicare and Medicaid, call the number on your screen now and speak with a licensed Humana sales agent. If you're eligible, they can even help enroll you over the phone in a Humana Medicare Advantage dual eligible special needs plan. And remember, annual enrollment ends on December 7th. So call now. Humana, a more human way to healthcare.
All right, folks, let me tell you. That's not only a commercial. That's not only an ad. That's a 2-minute ad. And I played the whole thing because I wanted you to see that they're offering you the world. Oh, you're going to get groceries. You're going to get drugs. You're going to get a card that if you don't spend all of this money, and by the way, all of that money is government money. That is the money coming from a piece of the money coming from the government, that they afford you a piece of the money the government gave them for you. Okay? Every time I see that, I feel sick. Because right there was cha-ching. The amount that commercial cost them could have bought a whole lot of Medicare insurance for a whole lot of people. For that one commercial on one station. Picture that commercial on every station in the United States. That ad. They have that ad running all over the country and many others. Some promising even more. To get you to sign up for Medicare Advantage. And some of these plans, it's only gonna be, you pay $0. I know, Bruce, I should get paid for running that ad, right? But not really though, because I'm telling people, look at that ad and make sure not to get Medicare Advantage. All right, I want to start out by saying the following. If you are poor, very poor, and our government for all, well, actually, let me back up. Not if you're very poor. If you're very poor, you can get Medicare Advantage, and then the other piece is taken care of by Medicaid. Okay? But if you are in that sweet spot, you will have no choice but to get Medicare Advantage. Because again, they have these plans that you have $0 copay, you also don't pay a premium, etc. That is I understand that. So if that is a situation that you're in, please don't feel bad about, I shouldn't have done that, or you didn't have a choice. And you probably can't get back. You probably couldn't afford to go to Medicare, traditional Medicare, as well as get in your Medicare program to cover the 20%. That's how screwed up our healthcare system is. So Medicare Advantage for some people was the only saving grace, but that's a small quantity of people. For others, they'll need to make, it is best to make a little sacrifice to purchase your Medigap program to cover the 20%, but stick with traditional Medicare. Let's first tell the story about Medicare so that people understand how we got here. I know some of you have heard me talk about this before, but many of you, in fact, I'm looking at probably most of you have not. So I'm going to go over that. But before that, let's see. Bruce says, they hang up from one place, MS treatment from another, and physical therapy from another. At all the best in Houston, tell them I get cancer treatment. Some carriers are dropping their standalone Part D coverage and referring you to an Advantage plan. Yeah, that is how it starts. That they want to have that cascading effect on people. But anyway, let's talk about it. Let's talk about how Medicare came to be in the first place. There was, as you know, when you get older, you get sicker. You require more care. Private health insurance companies are not providing health care because they're nice people. No corporation provides health care, or no corporation provides a service because they want to be nice. Corporations are there to make money, make a profit for their shareholders, and a whole big fat check for their executives. And here's the truth. I don't have a problem with that at all. But corporations don't belong in certain parts of our economy. Corporations don't belong in healthcare because they must find a way to make a profit on healthcare, and that is immoral. It is immoral for anybody that is not providing a service to just be in business to make a profit on your health. It's just an immoral thing. So, in the past, people would not get covered because it costs too much money to insure older people, and then they cannot make a profit insuring older people, and such they let it go. They stop insuring older people, but people get sick. The government comes into the fold. We, the people, come in and say, okay, what we will do is we will be the insurance of last resort. And everybody in this country who works will have to pay a small percentage of their salary, their income, their wages. That amount is about 3%. So from the time you started working, you have been paying about 3% or so for your health care. A lot of people don't know that, but when you pay FICA, a part of that, there's FICA that is about 6 point something percent, and then there's a Medicare tax that's about 3%. Everybody pays it. Absolutely everybody who works pays it. So don't think about people snoozing off the system. Everybody has paid for their Medicare, or they have had a stake in their Medicare. Now, when you become 65, that is when now you can take advantage of the money you have been sticking into Medicare for decades. I've been working for 40 odd years, I guess. All that money that I've paid into Medicare for decades, and I was looking at my statement, and it's a lot of money that I put into Medicaid. It comes out in your Social Security statement, Medicare, that is. Now, so when you become 65, you get Medicare. And the way it worked in the beginning was that you get Medicare. When you get Medicare, you go to any doctor that you want to go to. You can go to any doctor. And that doctor then goes ahead and bills Medicare for the service he provided to you. If he says you needed XYZ medicine, he'll provide that medicine for you. If you needed a surgery or whatever, except for very, very few surgeries, unless it's something extravagant, you never had to ask for pre-authorization and go through AI or anything like that to get services. Your doctor, your board certified doctor, determines what sort of service you need, and you got it. The parasites then came into the fold, the corporations. They created a story and they bribed our politicians to say, hey, let's make a deal. You've collected all of this trillions of dollars over the years in Medicare taxes. You've collected all that money and you have all that money for all these people that are going to require Medicare. Remember, these are the same insurance companies that said they stayed out of the older care market because they couldn't make a profit. But somehow now that the government has collected all this money for older folks, they are going to provide a service now that, wait a minute, if you couldn't do it before, why would we allow you to do it now? But they bought politicians on this issue. They bought politicians and said, hey, here's how we can do it. For a fixed cost, for every person that you sign over to us on Medicare Advantage, you just give us that money and we take care of everything. So if we sign up 1,000 people, give us $12,000 per person, and we will take care of all their healthcare needs. I don't remember what the number is right now, but maybe somebody can look it up for me. How much? It's several different numbers based on the sickness level of each person that has signed up for Medicare Advantage determines how much the government gives them for that particular person. And then they take all that money and they say, okay, we'll take that management stuff off of you. Now, the government pays between 1% and 3% to manage Social Security, to manage Medicare. But somehow now, these parasites now want in, something they didn't want before. They want in now because the government has already collected all these premiums over the decades for everybody. And our politicians that are bought says, okay, we'll allow you to do Medicare Advantage. And we'll even allow you to call it Medicare Advantage. Medicare Part C. It's not Medicare. It is private insurance with the same problems private insurance have all over the place. But our lonesome government, bought we the people, went ahead and said, okay, private sector, you can go ahead and manage, we'll pay you a certain amount for every patient that you have. But again, check this out. A company, a corporation does not only have to provide a service or a product or a service and a product, a corporation is responsible for also maximizing its profits for its shareholders. So, out of that money that the government gives to these private companies, they have to, when they're done paying the healthcare bills of the old people that they are insuring, they must end with a profit so that they can give their shareholders, with bonuses so they can give the executives of the company. How in living hell can that be more efficient than our government paying the bill directly to a doctor or buying the medicine directly from a drug company? It's impossible. But because they assume the American people are not paying attention or the American people are stupid, they figure, yeah, it's good. We'll create Medicare Advantage where these parasites or take a whole bunch of money for each person. Now, here's what they also do. They make, you get more money for sicker patients from the government. So they make their patients look sicker than they are when they're talking to that patient, to the government. And when they're dealing with that patient and their doctors, they claim that patient is less sick. Every drug that they are going to assign you of consequence has to be pre-authorized. Every medical treatment of consequence has to be pre-authorized. So when your doctor goes out and say, I need to take out that stone out of somewhere, and they call for pre-authorization, the first thing that happens is the pre-authorization takes a long time. Why? The longer they keep you waiting, if you look at the whole expanse and things, that's stretching out the amount of money or the amount of time they can hold on to money. But also, it gives you a better chance of dying. And a dead person, if they figure you are going to cost the system a lot of money, in other words, it could be that you cost more than the money the government gave for you, because they're taking a pool of money and they're saying, we are going to manage this entire pool for all the money that the per person takes. And they want, after they've paid all the bills for each of those people, to be left with a bunch of money to give to their shareholders and their executives. So they hope by delaying care, they can get you to die, because it's better to lose the money the government gives them for just you than for you to cost the whole pool of money a lot of money. So they want you to die. Delaying care, denying care, that's their profit margin. Delaying and denying care. Delaying and denying the ability to get the drugs that you need. It is by definition what they do. And more people are gravitating towards Medicare Advantage because of ads like I showed you up front. The ads are misleading. The ads are terrible. The ads are bad. Now there's something else I want to do, however, because it's not only that it's bad, it's that Medicare Advantage will cost many people their lives. And if you doubt me, if you get cancer or certain kinds of illnesses, what you want is you want to be taken care of by these places that have the best service for a particular type of cancer. But here's a problem. There are many of these places that you are forbidden to go to, and these places continue to grow. And I'm talking about the major points. I want you to listen to this brother on TikTok who's pointing out what's coming to pass this year. So let me just give a blanket statement. If you have not signed up for Medicare Advantage, you have till December 7th to decide, if you're turning 65, what plan to go with. Do not take any Advantage plan, and make sure to determine that what they're signing you up for is a Medigap program and not some fake Medicare. They fool you into Medicare Advantage. Get your traditional Medicare and your Medigap plan. If you can't afford the Medigap plan and you don't have relatives that can help you out with this, I am sorry, for now, you may just have to do the Medicare Advantage. But rest assured, our fight. I see my brother Chuck Pinocchio is in the chat. His fight with his organization and all these other organizations is eventually to get rid of Medicare altogether and give us Medicare for all, healthcare for all, single payer system. But I want you to listen to this guy, and then we'll take it on the other side.
Mayo Clinic, Sloan Memorial, MD Anderson, Mass General, Centra Health, now Kettering. What do these hospitals have in common with each other? They're some of the most respected hospital systems in America. And now they're in the news because they're cutting ties with Medicare Advantage plans. It's not just happening in one market either, it's all across the nation. But here's the question: why? Why are hospitals cutting their relationships? Why would the same hospitals that are currently treating the sickest, most complex patients, that have built their reputation on excellence, step away from a program that now covers half of all Medicare beneficiaries? This is Ann Saul, your Medicare, probably 4 or 5 minute. Let's get into it and we'll talk about it. All right, so why are hospitals across the nation showing up in newsreels now that they're leaving Medicare Advantage networks? It's because according to them, they can't afford to keep fighting to receive payments. So if we look at traditional Medicare, when traditional Medicare, a claim is filed, is processed by what's called a MAC. If you're not familiar with that language, a MAC is a Medicare administrative contractor. Their claims are paid quickly, usually within 2 weeks, and they're based on a transparent fee schedule wherever your zip code is across the nation. Medicare Advantage, however, hospitals deal with private insurers. These insurers base their negotiated rates with in-network hospitals, and they apply prior authorization rules, and sometimes they delay or deny payments for care that traditional Medicare would have automatically paid. That's probably the heart of the issue. Doctors, hospitals, admin staff are spending more time appealing claims than they are treating patients compared to traditional Medicare. Medicare Advantage plans, we know they're paid a capitated rate. Remember, that's a fixed dollar amount per member per month that CMS gives them. That payment assumes the plan will manage their care for their members effectively and efficiently. But when utilization spike or when hospitals treat patients who are older, sicker, or more complex, that flat payment may not stretch. So in order to stay profitable, a private health insurer must do one of three things. Number one, they have to cut reimbursement rates to providers. Number two, they would have to increase prior authorization denials. Or number three, what we really see, and they have to exit unprofitable markets. So in 2025 alone, the top MA and MedSup carrier, United Healthcare, they announced exits from over 100 different counties. Humana cut dozens of their plans, and it's not a coincidence. It's the MA model reacting to this cost pressure. We'll take Mayo Clinic as an example because that's the latest one I've seen in the news. They announced no longer will they be accepting most Medicare Advantage plans from United Healthcare or Humana starting January 1st of 2026. What's their reasoning? They say it right here. While our exact reasons are complex, this is occurring a part of a broader trend of hospitals and insurers renegotiating contracts, often due to issues like reimbursement rates and prior authorization denials. Now that's a distinction that Mayo has between traditional Medicare and Medicare Advantage. Mayo is essentially rejecting that middleman because they're saying it doesn't add value to them. It's the same story at Mass General, Brigham, or Central Health, or Memorial Healthcare Systems in Florida. The language they're using is identical. Low reimbursement, slow payment, and administrative burden. What does this mean for your Medicare Advantage members that you have as enrollees? Well, it could mean essentially that they're losing access to these elite hospital systems unless they swap back to original Medicare. Now, this isn't some kind of fear-mongering. I'm not trying to push someone to leave an MA and go to traditional Medicare, especially if they can't take a Medigap. I'm just sharing facts from the actual hospital systems. Many members choose an MA plan. Why? Because of lower or $0 premiums compared to Medicare Supplement, but most people don't realize the trade-off in flexibility or network access. And when hospitals leave, especially in the middle of the year, those trade-offs are visible. Members now discover that if they're covered, it doesn't mean that they're accepted, right? A PPO is not a Medigap plan. A PPO can reimburse or pay wherever you go in the nation, but the problem is the hospital or doctor has to accept that plan. And this isn't just one hospital or carrier that's an issue. It's a systemic issue across the board. As medical inflation, prior authorization burdens, and risk adjustments tighten, we're likely to see more hospital systems follow suit to this. What's the result? The two-tier system inside Medicare itself. We have one that's built on fee-for-service transparency and another a managed care, will continue to have friction against each other. So this phrase you might have heard in the news, the coming provider divide, it's not really just a headline, it's the phrase of the next Medicare story. So the message that's being received is being received loud and clear. The more hospitals that are walking away or turning down renegotiated contracts with Medicare Advantage organizations, that when a program that's built to improve care begins to limit it, the providers, the ASCs, the hospitals are quietly stepping away. And the ones who are understanding the system, that would be you, the agent, or the carriers that you write for, the consumers, or even the physicians, the hospital systems that are bowing out. They have a duty to tell their story honestly, because knowing where these cracks form in plans is how you educate a member. It's also how you build stronger, more entitled recipients.
And that's the problem, folks. You notice what he said? These people selling this stuff, they need to be honest. Unfortunately, there is no incentive for them to be honest. Why isn't there an incentive for them to be honest? Because they make so much money lying to you as they're selling you Medicare Advantage, telling you all the great things it's going to do for you, just like the commercial and the ad I showed you in the beginning. So what do we do about this? We have to educate everybody. You have to be, if you are younger here, but you have aunties, uncles, mother, father, brother, sister that is deciding whether to go on to Medicare, make sure to let them know that Medicare Part C ain't Medicare. I repeat, Medicare Part C ain't Medicare. Medicare Part C is your generic, regular, private insurance with all the problems that comes with it, and progressively, people, hospitals, good hospitals, are dropping them left and right. When this young man speaks about a two-tier system, he's absolutely correct. It's going to be those who have Medicare, which is going to be the same way we have that division where a bulk of the people are in Medicare Advantage and a small number remain in Medicare. We're heading there again, unless we get smart. We don't want a two-tier system. We want everybody to be in traditional Medicare, and we want to get rid of that 20% gap. We want to make sure that Medicare pays the entire bill because we paid for it. And what we have now are the parasites, the corporations. Every single corporation that says they're going to take your Medicare money to provide you Medicare Part C, meaning Medicare Advantage, they are thieves, they are thugs, they are legal criminals. Because they know that in order for them to pay the shareholders, in order for them to make these big profits for their executives, they have to screw you. And there are two things we should know here. A lot of times when they're screwing you, you just don't know. You just don't know. But here's the deal. I am here telling you what can be corroborated, and I've written several articles on this. I'll probably put that in the blog when I'm done with the show today. Tom Hartman has written several blogs on this as well. In fact, I also interviewed Tom Hartman with one of his books that he wrote on healthcare about this particular issue as well. Bottom line is the following, and for those just coming in, you can go back and listen to our tape. We'll have some of this. It'll be up later on today, but here's the deal. If you can afford your Medigap, if you can afford a Medigap program, get the Medigap program and stick with traditional Medicare. They will try to convince you by all cost to take Medicare Advantage. They will do that because the people selling you Medicare Advantage make a killing on every sale that they make. That's how profitable Medicare Advantage is for these people. But as soon as a particular plan, a lot of people have had great experiences with Medicare Advantage because, again, they never had to use it to its fullest. They never felt, and even if they got sick, the plan that they're on had sufficiently healthy people that wasn't there to really deprive that program. But brothers and sisters, if it doesn't happen to you today, tomorrow, or the next 5 years, it will happen to you. The programs are frauds. And I'd like, as I always invite anybody who wants to refute what I'm saying today mathematically, because I so want all of you that are listening to me right now to understand the honesty and research that has gone behind what I'm talking about today. When I tell you, those of you going on to Medicare Advantage who doesn't have to, who's just trying to save an extra couple $100 or so a month, you're playing with your life. those that are already on Medicare Advantage because they just had to, let me give you a few things to talk about. There are ways to force. It won't work with everybody, but it'll work if you are assertive enough. And here's what we do. I'll first tell you a KPFT story. There was a caller who called up and pointed out that their parent thought they signed up for Medicare Advantage. For traditional Medicare. That's what they told them. They told them they signed up for Medicare. It's traditional Medicare. When they were about to kick them out of a hospital, she needed therapy, and they were kicking them out because it expired, even though they said she had traditional Medicare. And what she found out later is that what the mother really got was traditional Medicare. Was Medicare Advantage. So they kicked her mother out of the care center. And she appealed twice, and they denied it twice. And when she called the station, I told her, appeal it again. And let them know that you are speaking to the media about this issue. It wasn't even a week that she called back our radio station, KPFT, and said they reconsidered and took her mother back in. That's what happens when you're dealing with a fraudulent system. That's what happens when they don't want to publicize how lousy they are. So what I'm saying is the following. If you can afford the traditional Medicare with the couple $100 or whatever it's going to cost you to get a plan to cover the 20% gap, please, by all means, invest in your health. Invest in your life. If, however, you are unfortunate and you have to go for traditional Medicare where everything has to be pre-authorized, etc., here's what I want all of you listening to my voice to do. If you get sick and they're giving you any kind of problems, let them know that you're going to the media, and you come to us and you go to others, and we will put it out there, and we will make sure to shame them into, God, they don't mind making the exceptions for ones or twos or threes or four people or whatever, just to shut you up. We will be here to go ahead and help you out by publicizing, writing it, making sure it's well indexed, putting it out there, making sure the search engines find it. We will make a story out of it, because that is what they wanted to ensure didn't happen. Why that person got her care right away. So people, if you have any questions, or please go ahead and give me a call. 281-823-7747. Let's see, 281. I always forget the number, 823-7747. If you have any questions, or if I wasn't playing on something, or if you want to add something, or if you want to tell me something that I missed, please go ahead and give me a call. I'll keep it open for a bit. 281-823-7747. Una vez más lo voy a repetir. One more time, I'll repeat it. 281-823-7747. In the interim, as I wait for a call, our brother Tom Zarnick has a limerick. And you know I have to read our brother's limerick every time. And I'll try to read it. I haven't read it. I just took a copy-paste so it doesn't scroll off. Hello, Bridge MCP. How you doing, my beautiful lady? Here we go. The haunted house near the hill. Oh, that's, I think, the title. All right. Punto part 1. The White House in D.C. is haunted by a ghost whose white sheet is often flaunted. He floats from room to room, howling at the harvest moon. Oh, I tell you what, I need to start over. I want to do it right. Okay, let's do it. All right, here we go. The house in D.C. is haunted by a ghost whose white sheet is often flaunted. He floats from room to room, howling at the harvest moon, where the east wing used to be, while on the street you'll see We the people through taunted are steadfast and undaunted, determined to fight monsters in each city, ice ogres that scare everyone they come near, spreading hatred and anger and fear, making friends and neighbors disappear. All for the ghastly ghost in DC who has no pity. All right, now part 2. For the ghastly ghost in DC lacks any empathy, a would-be deadly dictator in a tyrannical autocracy, a king of the zombies who would eat your brain and drive those who are left quite insane, a Dracula of vampires who would suck your blood, a drag us through the mud with crud from false news. Yet, we, the people, remain steadfast and undaunted, determined to take back the White House that's haunted. Be part of the solution for a new American revolution to end the chaos and confusion and save our democratic republic and constitution in a peaceful country where no one is above the law, a land of the free with liberty and justice for all. That is very, very good, my brother Zarniak. That is from our Tom Zarniak, guys, and he always has a great one for us. Hey, you know what? This one was worth the wait. We hadn't heard from you in a while, but you know what, Tom? You did it again. All right, let's see. Hirut Kirun Marianne, welcome aboard, beautiful. She says, Reagan made everything illegal legal, and that when we got screwed while we were all asleep on the wheel. Exactly. Chuck Pinacchio says, bring the truth, brother Egberto. Privatized profits, first medical industries are fleecing us, hurting us, killing us. Cheryl says, but be careful, they still take proper care of her mother now that they took her back as they have been outed. You're right. But you know what I think, Cheryl? I think that because they know that she has a spine and that she'll fight, my hunch is that they'll probably take better care, but I could be wrong, but that they'll take better care of her. Marge KJ says, nice limerick, Tom. But of course, Tom, you know that. You know that. Let's see. So, before I close out on Medicare Advantage, does anybody want us to, if you can put it in chat now, by the way, I would have to scroll up the chat. Go ahead and put if there's anything that I didn't cover. Chuck, did I miss anything of substance? I understand there are other parts to Medicare Advantage, but I don't want to go into too many technicalities because people don't need to know the technicalities, right? That is on the other end, behind the scene. Does the Mayo Clinic people visiting the emergency room that already can't afford aren't gonna go and not pay the bill? Yeah. I mean, by law they have to take anybody who comes into the emergency room, and there is a fund, a federal fund that pays these hospitals. And by the way, that is the fund that the Speaker of the House wants to cut because he claims that those illegals are the ones making off with that money. It's a shame. He's evil. That is an instantiation of evil. If you get hurt in France, if you get hurt in Great Britain or the UK, if you get hurt in Canada, if you get hurt in Australia, Israel, which has a sort of a socialized medicine in Israel themselves that we pay for, or because we can give them so many bombs, they can pay for. Yeah. You get care. Our level of evil when it comes to these corporations are unmatched. That's all I can say. It is unmatched. It is completely unmatched. All right, Joe says we can record ahead of time or live, but lifetime spoken word artist. But let me apply for the job. I would be so pleased. What are we speaking about again, Joe? Let me see. Yeah, I request to read one of his poems sometime. Okay, anytime. You hear that? You hear that? Joe wants to read one of your poems. That would be great. Absolutely, Joe. I tell you what, the next time we'll go ahead and you come on the phone I think that's what you were saying, right? We can record ahead of time or live. We can do it live. Yeah, I like doing things live. All right, folks, 281-823-7747. Una vez más lo voy a repetir. 281-823-7747. 281-823-7747. And I know we have to have somebody in the chat that has questions on the Medicare Advantage fiasco. Give me a call. 281-823-7747. Before I go to the other subject, yeah, we have only about 7 minutes, but the other subject I can finish in a minute and a half, actually. So give me a call. Here we go. Brother Brackens, talk to me.
Yes, brother. Yes. I'm listening to you with the Medicare Advantage commercial. I had tuned in a little late, and I was like, wait a minute. And then I saw that your tagline was at the bottom. Because I was like, is this a Medicare Advantage commercial on the? Because I was looking for you when I first started the show in my algorithm, but I see what you were doing. They love to play that, you know.
Yeah, they like to play that game. Go ahead. Hold on, Harry. We have
Harry. Okay.
Yeah, brother. Go ahead. Finish your statement, brother.
Yeah. So I know what it's like to like not be able to ignore that because people want as much coverage as they think they can get on the low, and it's, you know, quite a fallacy that it's basically taking money out of the government system and giving it to the private companies, and then, like you say, when you don't get sick, it's okay. Now, I'm a little concerned personally because my father is in the hospital right now, and he has Medicare Advantage, but that's only because he got it from my mother's coverage, and it stayed grandfathered in even after she passed away. And I don't really know how to change that situation, and he doesn't feel the desire that it needs to be changed. So,
well, the thing about it is he may get good care. Don't get me wrong. I mean, he may get good care. The thing about it is, in the aggregate, the care is not going to be good. Or let's say your father was to get something that is really difficult, and they say, well, the only place that can treat it is Kettering, or the only place that can treat it is Memorial, right? As you can see with the young man that I put on earlier, he said they are not treating any Medicare Advantage patients, period. They have stopped treating Medicare Advantage patients. So if they have a specialty that only that can be done, that person is host, they won't be able to do that. So, I mean, there are so many factors here. Now, a lot of older folks, Ray, you know, they just don't want to be bothered. They're like, you know what? I'm near the end of my life anyway. What the heck? I'm not going to go through and fight. Not realizing that, no, you got a lot of life ahead of you. You know, come on, we all have to fight together to get rid of Medicare Advantage and start fighting for what we've all worked for. Because, Ray, you work. Every time you got a check from whatever nonprofit you work for, Ray, I don't know if you realize you've been paying into Medicare from the time you've been working, probably from you're a teenager. You have been paying into Medicare. Yeah. Many people don't know that.
Yeah.
You know, but anyway,
I'm aware, you know, I know.
Let's break
the taxes.
Let's get Harry into the conversation. Harry, what's up?
Hello, brother. Hello, brother Ray. Well, you covered everything as far as the Medicare, as Jack Van Dever would put it, take advantage as usual. And when these they want to privatize everything and socialize the costs, as Randy Rhodes would say. And as others would say, as my father drilled into my head when he had USA Insurance, he said, son, insurance companies are in this business to make profit and to satisfy their shareholders so that their shareholders will buy their stock and their stock will go up. You know, it's all about profit with them. And they want to bring in a lot of people that take advantage of them. And screw them, as you said earlier. They can't find aside people who are invested in Medicare, take advantage, unless they screw the general consumer, who may be ignorant of some things and don't know how they're being screwed. That's why we have Eberto Willis. That's why we have Tom Hartman, and we have an Arnie Arnson and others to edify us and to enlighten us so we are not taken advantage of. And one other thing I was going to mention, I mentioned it this morning. I tried to squeeze it all in. I should have called earlier. That Grim Reaper skit that former Labor Secretary Robert Reich did about how the loophole is put in there to screw so that to screw the general public, but the rich, how they use death to screw paying their fair share of taxes and pay and avoiding taxes, and how they are able to pass that down. You can go on the YouTube website and look that up. They pass it down from generations, and the children who are wealthy don't have to work, and they can borrow against it. They can also, if they die, then then the money just goes back to their to whoever it was passed down to, and then they avoid those taxes. And so what Robert Reich was demonstrating in there is he's saying, look, and Elizabeth Warren has said this as well, we've got to have a wealth tax, because if you tax them on their income, they're not going to really get taxed. You got to tax their wealth. Even Warren Buffett has said, I need to be taxed. We need to have a wealth tax.
That is a fact, Harry. I mean, for people, I try to give some of that commentary as far as how the wealth, how these guys borrow money for income. They don't spend money for income. They borrow money for the income that they use, and that way it is not something that's taxable. But anyway, I got to close out this baby. Anything else you want to finish with? Exactly, Ray. Is there anything you want to close out with before we end?
Yeah, I want to say thank you, Harry, for bringing up that tax point, because I want to end on this. You know, at the end of the day, we have to learn and understand that when it comes to wealth, the player of the game is always taxed differently than the owner of the game.
That's
and
right.
yet they're both rich, but they're differently part of the society, as where one is working class and one is business class. I call them business class criminals. But anyway, I'll leave on that.
Well, there are two Americas, as Robert Reich pointed out. There's two Americas. The wealthy don't pay taxes, and the people who live paycheck to paycheck get raped and pay taxes. And that's not fair.
Okay, Harry, gotta go, brothers.
Right,
I gotta go.
Have a good weekend, guys.
Y'all have a wonderful weekend. Thank you, brothers. Bye-bye. All right, thank you for the call, guys. Love you all. Look, I hope that I got the message across with Medicare, and I'm going to be coming back to Medicare again several times between now and December 7th, which is when the window closes. But I want to stress this, people. I can't stress it enough. Don't sort yourself by going to Medicare Advantage. If you can avoid it, if you can pay for that Medigap, please do not sell yourself cheap, because it is something that could come back and bite you. While I am talking to you guys on this program in this hour, that commercial played 3 times. I want you to think about that. That 2-minute commercial played 3 times. You know how many hundreds of thousands of dollars that is? Does that tell you what kind of money is involved in Medicare Advantage? Anyway, I got to get out of here, folks. I really thank you for listening to me. I'd like to invite you to please become paid subscribers of our program. We cannot do this without you, and we're over 500-600 people short of being able to be at a break-even state. So it would be great if you become a paid subscriber. And to do that, all you need to do is go to politicsdoneright.com/newsletter and go ahead and say, I am going to be that paid subscriber. And I'm putting the links in both. Come on, put it in that chat. Donde diablo está? No me está sirviendo. There we go. I just got it in. There's the first chat. And here it goes in the second chat. So folks, please support the program however you can. Anyway, remember, you can email me directly at info@politicsdoneright.com. info@politicsdoneright.com. I love you all. My name is Egberto Willies. This is Politics Done Right. And you guys know how I end this baby. I am what? Out! Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EGBERTOWILLIES. That is at Egberto Willies. Let us engage. It is Politics Done Right.